Good morning. Welcome to another episode of Acquire the Future podcast. As your host is Shay Maroney, I'm excited to have another podcast session with Dr. Jake Behrens out of Milwaukee, Wisconsin. He is a board certified psychiatrist with Envision ADHD. And just another welcoming. Our podcast today is sponsored by Acquire AI. If you need any business needs, please reach out to us on LinkedIn or acquireai.io. But thank you again, Dr. Jake, for being with us. If you wouldn't mind, just give us a little background about yourself to the audience.
For sure. No, pleased to be here. I'm here. I'm basically I'll say a little bit of a kind of an inpatient type of psychiatrist where I had been entire kind of way through it, always been in academics, following mentors, even staying on board after residency in where I trained in Madison, really loving kind of the type of job working with patients, but also on the sides, really being excited by workflows and working with different smaller tech startups, building outcome tracking softwares, tracking data with patients I was seeing, and finding within my little kind of my office, I always thought of that as my laboratory where I can bring in software, outcome tracking tools, the simple things. I'm not talking about, medications or electrodes or anything. I'm talking about like data gathering software, but finding that I couldn't really fit so many of the things I was working with other companies. I couldn't bring them into my own practice in the same way because of all the rules. So fortunately, I was one that ended up having to, I guess, leave a cutting edge institution to feel like I could have my hand in the driver's seat and bring new kind of practice models, new software, new workflows into patient care. So it's about, 10, 12 years ago now, where I made the really difficult decision to leave a great place, great department, to travel from Madison to Milwaukee as a non-compete kind of things, to start a different type of practice based more around kind of direct primary care, but more I guess specific to kind of an adult ADHD population, which was my niche and my specialty back at UW. And it was actually all built around how can I make this easier, more effective, and more convenient for a lot of my really busy project managers. I actually treated a lot of Epic, big health record company people that were very busy. They always had to drive downtown to see me in person or drive downtown to pick a piece of paper prescriptions once a month. And I felt like this could be done a lot more efficiently. So that's where Envision ADHD came from, is envisioning how would I want to get care, seeing the pain points that was around this population and building a different practice model. That's where it came. And now to me, it's my little baby where I can iterate very quickly. I'm constantly playing with different software, A/B split testing with different people to see what things fit. And to me, it's the fun of the evolutionary journey of continually building and fine tuning as you go.
That is amazing. And especially having ADHD, that convenience is very, very helpful. With starting the Envision ADHD model, is there a certain way your patients can see you? How does that all work?
To me, well, I think one of the paramounts, kind of, this is going back when building this out, initial process probably 12 years ago. It's been live about 10 years now. But so much of it came down to, okay, what is the patient journey? And I know myself, this is when even using Epic, my chart, some of the patient portal things were starting to come out. You could kind of message those about all you could do. And I was seeing there's so much more kind of pressure to get people using the portals, but that was falling on the physicians to have to then respond to things. And instead of a carrot approach, getting people to use it and encouraging physicians to get back to people and manage patients that way, it was more of a stick approach where if you don't get back to these, we're going to penalize you. But I was seeing so much care could be done asynchronously. Patients wanted to do things more in those ways. But then where I was starting to find in here is that's what patients want. That's what they can do. It's asynchronous. They can do it 24/7. It's not just during clinical time, business hours. And I was, even from the way of scheduling appointments, I know how difficult it can be. So I knew myself, heck, I won't get a haircut if I can't walk in or schedule it online. So to me, online scheduling, direct communications, even like direct transparent pricing. So this other thing I saw in healthcare, and even within a large institution, everything was done by insurance, but somehow I was always the front line for any payment questions. I always came through the portal. They'd come to me. I couldn't do anything about it. I started realizing the numbers that people are paying when they haven't met their deductible or things haven't worked the way they wanted to. I kept thinking there's got to be easier, more transparent, faster, cost-effective ways of building this out. So I always just wanted that person can go find a website, see everything listed out, transparency, what the services are, what the costs are, how it works, speak more to it, their specific pain points. So I would say I wanted to go more after a niche than broad, but I want it so click schedule now, see available times, schedule yourself in, immediately get set up on your portal, have all of your, I really want to get much more comprehensive evaluations than I could ever do in other places, of ways of gathering collateral information, much more detailed histories, rating scales, even bringing in cognitive testing in different ways. So if people would be off on the journey to have all of this data done, collected, then all the mapping into the notes. By the time I would see a patient, it's not just what I call like a cold eval. Like, hey, so what brings you in today? Okay, now we got an hour. We got to dive into all of this. As opposed to, no, I have more data gathered than I ever would have in multiple sessions in other places, done, compiled into my note, into the right areas, reviewed, so that we can spend, a much larger, even a longer evaluation time, really diving into the data, bringing up screen shares, showing what things look like, walking through whiteboarding, drawing out all the options, all the stuff I would do when I would be like turning my monitor around to show them the screen or drawing on a pad of paper between us. I wanted to be able to do all of that and really spend so much more of the time on psychoeducation as opposed to just data gathering and say, get that stuff out of the way. And I just found it just completely changes when you meet a patient for the first time. You're like, oh, thank you so much for completing all of this. I've reviewed it. Now let me kind of summarize a little bit and we'll dive in. It's like, it's just how different that is. And just like, hey, so who are you? What do you need right now is so different. And I guess that's where I wanted to get it, is how do we best fit this into the patient needs? And also, can we get online? Can we get it so people don't have to keep leaving home to drive into appointments? Granted, this is well before the pandemic when getting into tele. Can we make it so that prescriptions can be sent directly to pharmacies, get an electronic prescribing, which was coming out? Once again, this is me dating when making the decision, but I always wanted my patients, I want to make you more productive. I want you to focus better, focus more on home, work, life, relationships, school, what you name it, not just the hoops of jumping through platforms. And that's where it came from.
Correct. And being a working mom and being on ADHD medication and having to go see a doctor, it's very that I love that model, having to just get online, see you, have it all right there, sending 30 minutes in the car to drive to an office, 30 minutes back home, waiting. That makes it very convenient. And then that unlimited support is amazing. So other than medication, is there any other things that you do to help with ADHD?
Yeah, well, I always want to be able to have kind of a full menu of options, more or less discussed or reviewed. So I always want to start with a much more thorough evaluation that I can do, dive into a whole menu of options, put in people's hands. They don't have to move forward with anything, but to really go through, everything having to do with medications, really drawing out stimulants, non-stimulants, how they work, how they come off, how we would titrate such, getting into recommendations for therapy or coaching, and have a lot of resources immediately available to them in their shared session notes and on the website for them to get connected. And I found I was able to negotiate even like discounts with some of the online providers of bringing in. So I always wanted to be able to get any bit of savings available that I get access to available to patients. Going through things with exercise, different types of routines, various lab testing we could get into to try and get as specific as possible with various supplementation. And I always say I want to go for the full menu of options. We don't have to start with the kitchen sink all at once, but I'll have everything I talk through will be laid out in the session note, laid out for you with links, actionable things you can do. And I always be able to have it as even like talking points going forward in the future. But to me, it's coming at it in all those different angles.
Nice. Coming into that, do you find your patients being compliant with that? Or are they just more reliant on their medication? What is like the compare and contrast with keeping people compliant?
People come in with different wants, needs, expectations. Obviously, in the ADHD space, it is one of the few areas in psychiatry where the likelihood of benefit with the medications does stand out quite high, or the higher effect sizes of anything in our field. So oftentimes we likely to work with medication unless they prefer working with other aspects, because there's certainly downsides. One of risk, even just logistics of working with a lot of the medications people know is very difficult. Many times we'll really work closely to fine tune the dosing of medications, really getting into duration of effect and very close follow up with patients so we can adjust dosing. And then often I'll have regular things, even like general supplement recommendations, especially a lot for winding the mind down at night, kind of evening routines, help with sleep. Because untreated ADHD at evening time, that sleep time is going to be affected. And I always find is really drawing out and showing data with patients. A lot of outcome tracking, showing rating scales next to each other, correlated to the treatment options, tracking those over time so we can pull out what areas seem, what symptom clusters, what is standing out so that we can be as targeted as possible with those. I always find to me that makes kind of the shared decision making so much easier with patients. So we look at data, we see it, they see this is standing out. I'm like, well, here's some options in these different areas, but then in the end, it's always up to the patient. I always tell patients that I'm much more of a guide or a consultant. You give me data, I'm here to help kind of go through options and always here to give you any specific thoughts or kind of recommendations, but I just want my head to be an open book, which for better or worse, I can be overwhelming when I dive into it all, but that's always the caveat that I give.
Hey, that just means you're very passionate about it. Love that. With coming into everything, I know Envision is your baby, but you also do branch out into other adventures. If you wanted to kind of express about that, helping people with that maybe want to grow a business or start up a psychiatric.
Well, I know when I was starting this up, it was difficult, reaching out to a lot of mentors, Behrens institutions, a small business type of thing, didn't know, got in with, paying large amounts of money for some business development or business mentor type people. And everyone only talked about like more pie in the sky, kind of like broad grossing things. Like, no, I just need the execution. I need the small nitty gritty workflow type of things. Setting up your business startup. What kind of forms do you need? What now? Fine tuning the EHR to and the patient portal EHR website things for how to get everything plumbed together. Those were the things that I really wanted, I guess, people to run that through or run by or get help with. And that's what I never had access to. This was a lot of product testing, a lot of building out. So for me, it's something that had come up. It was during the pandemic when the pandemic first occurred, and so many places were being thrown into telemedicine. I was very fortunate, been doing it for 4 or 5 years prior to that happening. So to me, it was an easy transition. And I was involved in a lot of online psychiatry forums, a lot of Facebook groups where a lot of people are reaching out for help. And they're trying to respond to messages, which is stuff, talking technical things, but typing it out's not so helpful. And I think through a lot of survivor's guilt, I think I wanted to get in there and help people to transition, old people from my department, work at APA and other places. They knew the things I was doing. So a lot of people were reaching out specifically. And I always knew it's so much easier just to get on Zoom, do a screen share, do whiteboarding, walk them through, show them how things work versus trying to type it all out over and over. So at a time, I just wanted the easy way for people to schedule a time to meet with me online. I was actually A/B split testing a different health software. So I decided to use that to onboard quote unquote clients. So I created this telepsychiatrystartup.com. I just forked my website. It's people could schedule so we could get online to walk through problems. And I found people wanted a lot more help in the actual setup of things. So that turned more into more just kind of a by the hour schedule appointments kind of consulting business to help set up. I'd say the website, HR workflows are the parts that I get into so much.
Awesome. And with that, what is mainly one pain point that are a common theme that most of these startups have when they're coming to you?
Well, I think a lot of people have this idea that they want their own business. They want to do it on their own. And I think sometimes we have this idea that, okay, we want, this is I remember even being told in residency or in academics, everyone that it seems like they go off into private practice, they have this idea that you need to cast a wide net. You just need to take anything that comes your way to get any type of patients you need. So it means you have to cover and do everything. But that's what every general practice does. And if you talk to anyone in marketing, it's like, no, you kind of need your niche. You need to be able to speak to and I think for your understanding, who is your ideal patient? I think that's the power of private practice is I always like the idea you pair it like your interest with the people that align with that interest. I think to me, that's much needed just for satisfaction on both parties' sides. But I think some people, really need to define who is your ideal patient. What are you trying to build? What is it that makes you or your practice different than other places? What are they not getting that they're not going to get from going through their insurance and finding a place? I think that's something that a lot of people haven't really kind of thought through. Just think, well, I'm a psychiatrist. Here's my board certification. I put up a shingle and people come to me. Like, that's not really how it works. I think we have to speak less about who we are and more about, we need to speak more to the patients that we want to help and how. But then I also think, it can be overwhelming. How do I set up? Most people don't know a lot of, just website design, what needs to be on it, or drowning in like how many EHRs are out there, which one do I get into? Myself, I probably product tested 30 to 40 when I was starting off, but that's what I love to do. I'll take a weekend at a coffee shop and do that till my heart's content. But I think the actual building out of getting all of the fine-tuned things in place. What do you want your logo, your colors? What do you want what forms do I need? How do I map this? It'll be software dependent. But I think it gets overwhelming with a lot of the nitty gritty, kind of I call it kind of the nuts and bolts of setting up practice. And those are the areas where I want to get in. And I always say my goal is I don't want someone to do it for me when I was starting up. I just want someone to teach me to fish, show me the tool, show me a little bit, let me get online, walk me through it, and then let me go off for the races. But I found many times here, I think so many are looking for, well, I don't want to have to think about that. I just want someone to do it for me. I'm happy to do that. But what I've always found then you're stuck. If you want to change this couple words on your website or change the price here or change this wording on your form, you can do it in 20 seconds if you know how it works. But if you rely on someone else to do it for you, which I think so many of these large consulting places are, you're going to be trying to communicate it to someone else, wait for them to do it. Maybe they did it right. And you're probably paying some large sum of money for that. I just know myself, one of the fun parts of private practice is I'm impatient. So if there's something I want to do or change, I want to do it in 20 seconds, not like 2 months type of thing.
Correct. Not telephone, wait maybe for 10 minutes to wait on hold.
Yeah.
Then, oh, well, you're fifth in line to get it done, and then come back if you learn it yourself, like you said, 20 seconds and you're done. They don't, when you're in medical school, they don't kind of teach you how to do all that. It's just
I find it funny in some of these private practice forums and then people complaining about like their health record systems, like how slow the customer support system is to get back to them. Like, I'm sorry, if you have to rely on their tech support, you can't just figure it out. That says there's more problems with the software than anything. Like, I hope that I never have to, but by the time I generally have to get the tech support, there's something wrong that's not going to be solved in the problem or in the software itself. So it's fine in there. I always want a tool that is flexible that I have control over versus something where I have to rely on some tech support for.
Correct. Yeah, it's that definitely, when you can do everything yourself, is a whole lot better.
Yes. And it's also different, even as you explore new systems. Like I call it like a hobby, but I'm always playing with what other software's out there, how, looking at other industries, how can we potentially build things into I always think of it's the patient-physician relationship is the core of everything that I come from. How do I get now? I want the dedicated patient app. I always think of the patient journey. How are they interacting with me? I can do anything on my end. I can live in 100 tabs. I can do whatever, because that's what I do day to day. But the patient journey should be as seamless as possible. So there's something that I always find, from an innovation standpoint, I should learn this way back from a book. If anyone's ever read 9.5 Things You Do Differently If Disney Ran Your Hospital, 97, highly recommend a read, but of looking at other industries, not just down the street at the other hospital system, or how do they do it? Because then we only have these small leapfrogs of innovation. I'd say I've learned so much more of following, honestly, nutrition, naturopaths, chiropractors, spa software. How are your customers, patients, whatever the heck you want to call them, how are they interacting in other places? How are they getting their haircut? How are they doing their spa service? How are they getting there, working with their coach or whatever? And can we draw other tools from there? So I've actually starting to see more overlap, not just from a health record system, which is built mainly on billing, but software that's instead coming from the other side is like a client provider relationship, whatever you want to call it. But actually, getting HIPAA compliance, making sure all your ducks are in a row, but coming at it from that angle versus just a billing angle has made a world of difference. And all the different type of tools we can do, and all it comes down to is it's good data mapping on the backside, which doesn't sound sexy or that exciting. But if I can have an easy way to interact with the patient, gather information from them, collate it, put it in the right places so that it then becomes clinically meaningful for documentation, for billing, for whatever you want it to be. To me, that's where the magic is in the middle there.
And speaking to like the industry trends and everything that's going on, and you looking at different businesses from here to there, have you seen anything in the AI side of things that has helped your business or helped people starting up?
Yeah, I see. As this come out, seeing AI scribe companies popping up under every every stone you turn over, there's an AI scribe company that seems to be coming out where turn this on, listen to the conversation with your patients, and then it'll run a note based on that. I always find that so limited because I was thinking, an efficient practice is I've already gathered so much information from patients, plus the information that's in the chart, plus the other forms, outcome tracking things we've reviewed. So what's spoken out loud that's going to be transcribed is only going to be a fraction of what would otherwise go into my documentation. So to me, just transcribing what I say, unless I speak out loud their full med list or everything else I've already looked at, like why would I speak that out loud just so it can be transcribed? I always think, in the way I've had to build with this, is how can I basically create for each patient, here is my master file, my master data set, so to speak. And there I'm able to put transcript data, chart data, any forms they've completed, outcome data, any reports kind of testing. And then I use that to do my custom prompts to, draw just on the data set. That's what I'll draw my documentation on, my assessments, my other information. So that's been a more difficult build out because a lot of companies, once again, it seems like they're only dealing with one data set, i.e. it transcribed. So that's been limiting, but I think that's going to get more and more powerful as we get more tied in with our actual EHRs. Even website design, just website copy. It's amazing what you can do for just getting language out. Or I think content marketing is this huge part where I don't trust anything I read anymore, because anything we know we can just generate that's out there. But if we're getting into SEO, we're getting into marketing, we're getting into ads, it's just incredible how much data we can generate on the marketing side, on the documentation side. Myself, just finding a way of analyzing, truly throwing in de-identified ways or HIPAA compliant ways to just be able to analyze large data sets. So if I'm putting in cognitive testing data, all of the history data, rating scales, collateral, and have everything collated, reviewed, and actually being able to run things by, being able to throw DSM criteria and really pulling out kind of for against far broader differential diagnoses, I think has been very helpful.
And so I want to go back to this where you said the AI transcribe. I kind of want to talk on that a little bit. What I was thinking, and this, see if you're right there with me, if you could get an AI tool, not to only transcribe what the patient says, but to read everything at once and make a clinical, what's the word I'm looking for?
Just documentation.
Yeah, documentation, and have like a list of things right there. With that going on in the industry, is there any pain points that you're seeing that would HIPAA be? How are the HIPAA laws with the AI?
HIPAA is regularly one of the largest pain points, just because of what it takes and having to sign business associate agreements, and the liability portion of it, more so than the security, would be the most limiting part. But then also just when everybody that you're working with uses, say, different EHRs and different platforms, even if two people are using the same EHR, likely they don't have access to the same data, or they have to open up different APIs and probably pay for it to feed data into different sources. So I think what I've always found is a tool that can simply use basically copy and paste, or from an EHR, if I can do a select all, gather everything, remove any PHI, and put that into a tool, or I can upload my PDFs from outcome tracking, or take a screenshot of rating scales, wherever. Now, just even if people are still using paper, you can take photos and put them in there. It's how we gather that data to get in one place, I think, is the most complicated. That's the pain point right now. What is the way? Because I always think of practitioners, we all work in different ways. Even if we're all institutions and we all work with Epic, we all have different iterations. We all have limited access to what it is. So any way that I always want a ubiquitous tool that any practitioner can get in, doesn't matter which EHR you're using, as long as you can somehow copy the data, put it in the right place, and use it. That's always what's on my mind.
And just kind of switching to like the future goals, where do you want to be with your private practice, or your little private practice, and then your other business in 6 to 12 months from now?
It's a question on my mind. Part of me is like, I always think of practice the way it's set is, crescendo, build up, and at some point it doesn't just like stop and then retire or whatever. It's going to be a decrescendoing time of letting kind of people churn and get back to primary care and get to where they need to be. So I'm not necessarily trying to scale. I've never been never looking for hockey stick growth. I think that's one of the downsides of any healthcare startup. If we have this idea that we just need to grow for the sake of growth, like most startups, that's what they do. I can't blame them for that. But that does not bite well with healthcare from what I've seen. We need to grow organically, learn as we go. So I'm not necessarily trying to keep ramping up on kind of new patients or whatnot. Where I get excited is the way of how can we kind of have tools, resources to meet people more where they are? Can I build this always sounds odd when I say it, but I think it to make more sense, but more of a marketing funnel. Sounds like what's that? I'm not just thinking about marketing, but meet people, what's on the site that they can start. If they have an interest in something, start free, take a free symptom test, something to get a little bit of information. And then if they want to dive deeper, all asynchronously, like, get them into your platform, get them into your product, and then, deeper between learning educational thing, courses, ordering labs, taking deeper dives into getting them set with resources. They could schedule their own coaching, get into their own, supplement protocols that with some evidence base, even ways that they could start a program where they're actually tracking their own rating scales correlated to their supplements to see, are they making changes? Can they do their own cognitive testing, gather their own data? And at some point is that they can work their way deeper and deeper into it. And only if they need to, then do they need to schedule an actual full medical evaluation and go that route. But meet people where they are, that they can do asynchronously 24/7, and they can dive deeper and deeper down into it already within one platform. They don't have to start over. Heck, even you went through all that stuff. Here's a discount code for your full evaluation. But make it so that only at the end of the funnel is that where they need to go do the big 2-hour evaluation, the big medical aspect. And could we potentially get a lot more care to a lot more people in a more scalable way in that aspect? I don't think scaling the medical side of it, that's the difficult part, but can we get the educational and get everything else in people's hands in more streamlined ways?
Yeah, that would be amazing. Just go click on one spot with everything.
Yep. Well, it's
And
kind
you
of like a
get
choose your own
more.
adventure. People can work what they feel comfortable with and keep gathering their own data, learning more and more about themselves as they go deeper down them. I say funnel. I know people are going to probably criticize that. I'm not looking at healthcare as like a
No.
marketing learning type of thing, but I'm just trying to think, can I have resources to help people as they need to? And only if they need to, then do they need to go much further with me? I'm trying to, it'd be cheaper and more scalable.
That is a definitely amazing goal. And I like that a lot. I think it would help out a lot of people because normally it takes 6 months to see a change with anything. So I definitely think that would
Yeah.
be very, very beneficial to a lot of the clients and the whole United States, really. What would be one major challenge that you would solve if you could today?
If I could today, I'm just thinking of like the small little pain points, which seem so small. Like, gosh, I wish if a pharmacy didn't have a stimulant prescription controlled substance. I know the laws changed to allow them to transfer it to a place that does, but it's so onerous and they refuse to do it. I could just get it if I send it. Well, actually, if I could change one thing, this would solve all of those. If I could prescribe why a medication doesn't go to quote unquote you as the patient, tied to you, your account, whatever it is that your identifier, versus me sending it to a pharmacy and it lives on this island that it's stuck on. Because as far as I'm concerned, I don't care where you get it filled. I care that you get your prescription filled as I intend it to be. So if it could go directly to the patient, this gets me thinking about blockchain in many ways for identity. But make it so that I want to prescribe to a patient, and then the patient has wherever they want to go. They could fill. They have record of it. Any pharmacy would tie into the same thing, see all your history. It should be tied to the patient, not to these individual facilities. And I think that is a frustrating part. I think in our country now, with it's a complicated area, but with I would say United States of America, my behind, because when we have all of the individual state rules, licensing, not just licensing, but also, it's a federal license, you need a DA in each state, a physical location. I'm not trying to open all that up, but I always find is if we truly care about a patient and them being followed, what is a better situation for the patient? If you are traveling, you're gone 2 weeks in Florida, do you go without your medication? Do you try and find someone that doesn't know you at all locally? And is that safer to get something filled by? Or is you having that connection online, which we can do easily, with the person that knows you well, knows everything about you, and just they're somehow a one-time thing or a way that they could send to a pharmacy where you are? And I think we get in our own way from our legal standpoint. And I think that we need regulations. I am all for them, not trying to take that away. There are risks with all of these. But I think we just need some more reason into how these things are done. And I also think we need a lot more clarification on the specific rules on prescribing, follow-ups, all of that, especially in the changing world of telemedicine now.
And what is one thing with the telemedicine that you would maybe want to change? Is there anything, you think it's growing great?
Well, it's once
With
again,
that
just even as a
portion of
term, there's be so many different ways. I still consult with some other large telemedicine companies. I keep a couple hours like for patient care. And to me, I always find just saying telemedicine is not all the same thing. Because if I would say the magic is not seeing and talking to me. That's one part. If I can't screen share, if I can't whiteboard, if I can't draw things out and educate, I always feel like I'm practicing with a hand tied behind my back. So if people are like, oh, telemedicine is just video audio, like, oh no, you're missing half of it. That you're not practicing the highest order of your license. But I think a lot of that part is going to have to change. Where can we get people so they can easily access it, be able to find it, schedule it, which I think there have been a lot of improvements with ZocDoc, other ways where we have more online scheduling. I think we have to get the payment side out of it, where I always think insurance makes things more complicated. Anytime we put any type of third party into it, it's going to, a lot of conflicts of interest. Is not making it easier. And I think we'll see a lot more of the innovation on the outside of insurance side first. I think just because you can move faster, more nimble, and quicker. But I'm hoping that the insurance side is keeping an eye on the private practice side so that they can learn some best practices. It's almost like free market, or free technical research, so to speak, if they keep their eyes and ears open. And I'm hoping that some of those parts will change. I understand, like, insurance is there for a reason. We want to be able to expand there. But we realize if people are leaving accepting insurance, that's happening for a reason. And what can we do to better address the pain points of the people that are leaving?
Correct. And I think that would be great, especially with insurance, because I know with the ADHD side, it's always a pain trying to get one medication from here to there. And that's one thing that kind of drove me when we were talking in our pre-podcast call about how you are very hands-on with your patients. You show them all the whiteboard things. And I think that's more doctors on the telemedicine side. I feel like you just talk to them and then they just like, okay, here's your medicine. Bye. You're sick. Look at your throat. On the medical practice side, bye. But that's one thing I feel like more doctors on the telemedicine side, I think that's what sets your practice apart from everyone else.
Well, I should add an odd, well, I've always been hybrid. I still always have met my people in person at least once. So I always keep that as part of the practice for prescribing. But something that actually hit me in this, I never would have thought this. I started, evaluations were always in person, long, formal, and more device-based testing. A lot of things are online, but it wasn't until I made a transition, I moved, and I just started doing a day a week to fit people in for their in-person startups after we'd done a big eval. But I realized I had switched to doing all my evaluations online, and I found out how much easier it is because we're already looking at the same screen. I can pull up a screen share. We're looking at rating scales. We're looking at their cognitive testing reports. We're drawing out all the options, and we're looking at the same screen. It's seamless. Actually, just on Wednesday, I went to go do my in-person thing. So my first evaluation, so 2 hours in my office, which is a nice place with couches, and it's a nice place to sit. It's the therapist office. But I did that because the patient had to leave, so we kind of fit their initial eval and then their in-person med startup after together. It was faster for them. And it made me realize just like, oh my gosh, this is nice. I'm sitting here, but this is terrible for actual like psychoeducation side of it. Like here I am holding up my laptop, trying to show them data from, I'm sitting 2-3 feet, like, I don't know, 3-4 feet away, not far, but it was so much more awkward. Or I'm hunched over an ottoman trying to draw things out in a little pad of paper. And it hadn't hit me, except I didn't make the change to do my evaluations online because it was, I think this will be better. I did it because it better fit my schedule and the way I could scale more. But going back to it after years, I'm like, I'm so much more efficient. I think it's a much better experience being online. And I never would have, I was never like, oh my gosh, online is better. I would 100% not say that. But after doing the two, it was night and day different how much I would say better at truly diving into data, being able to do psychoeducation and share that with the patient it was.
That's amazing. Well, I definitely want to thank you so much. You have gave us a lot of insight for our listeners, and I think it was very educational today, just from your Envision side to your startup side. I definitely love everything that we had. I think our listeners are very going to get a lot of education, and I definitely want to shout out, if all our listeners in the Wisconsin region, please go see Dr. Jacob. He can definitely help you out. And is there a way that they can contact you or anything, Dr. Jacob?
Well, on the practice side, obviously with their state limitations, just in Wisconsin.
Yeah, just Wisconsin.
EnvisionADHD.com. More on the workflow side, this is where I really get excited with practitioners, but working, if you're starting up with new HRs, I'm more on the outside of insurance side, I'd be more familiar with, but if their workflow questions are just diving into making that the patient journey easier or your documentation side easier. Those are the challenges I like. But on there, telepsychiatrystartup.com is the website put together. You can contact me there's a contact form at the bottom of that. Or even if it's just want to connect and dive into things, I think there's a schedule now button. There's the free online introduction. It's just a way to connect on Zoom and dive into what people are playing with, even as a way to connect. That's, I think, one of the best ways to connect is right there on telepsychiatrystartup.com.
Perfect. And that doesn't have to be just Wisconsin. That can be all over.
For practitioners.
Okay. All righty. Well, thank you so much. We enjoyed having you this morning.